Tungiasis, known as sand flea disease, is a skin condition caused by female sand fleas penetrating the skin of human or animal hosts. It falls under the category of neglected tropical diseases, NTDs, and is prevalent in resource-poor rural communities in sub-Saharan Africa, the Caribbean, and South America. This disease predominantly affects children aged 5 to 14 and the elderly, with some individuals carrying numerous embedded sand fleas, leading to significant discomfort. The female sand flea burrows into the skin, primarily in areas like the toes, soles, and heels, where it matures over a period of up to 5 weeks, laying eggs and ultimately dying. This intrusion triggers an inflammatory response, often leading to bacterial infections and severe inflammation, impairing mobility, especially in the feet. Factors such as poor housing conditions and inadequate hygiene practices significantly contribute to the disease's prevalence. However, there is growing awareness of the disease's public health impact, particularly in regions like Kenya, where valid epidemiological data remain scarce. To address this gap, a study was conducted in Kikuyuni and Malanga sublocations, Kilifi County, Kenya, focusing on households where no prior interventions against Tungiasis had been undertaken. The study involved a cross-sectional survey of randomly selected households, each considered as a single structure. Eligible participants were individuals of any age who had spent at least 4 nights per week in the selected household over the past 3 months. In preparation for the study, approvals were obtained from relevant local authorities, and extensive community engagement was conducted to ensure understanding and voluntary participation. The study, performed during a dry season, encompassed 1,086 individuals from 233 households across 8 villages. Data collection involved door-to-door surveys aided by local community health workers, CHWs. Structured interviews with household heads, conducted in local languages, gathered information on demographic, socio-economic, environmental, and behavioral factors influencing the occurrence and severity of Tungiasis. A scoring system based on household assets, rather than cash flow, was used to assess economic status, considering possessions such as radios, televisions, and mobile phones. Diagnosis of Tungiasis involved careful washing of patients' feet, standardized examinations, and staging of lesions based on their appearance and manipulation history. The study aimed to identify risk factors associated with Tungiasis, highlighting the importance of improved housing conditions, better hygiene practices, and community-based interventions to alleviate the disease burden in these resource-poor communities. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.